I found out I had COVID, kind of went numb. I came here on March 29th and I left June 4th. And if I had to choose any other place to be taken care of, I wouldn't go anywhere because the infirmary help was one of the best moves I think I made. They saved my life. But they really cared for me. I felt loved, blessed and loved to have so much support. It was a great place to be. I couldn't do anything about my illness, but I didn't have to worry about being taken care of.
So Mrs. Bond, when I reviewed her case, was definitely in really dire circumstances and was not doing very well. Because of the disease and because of ongoing issues, additional treatments were tried and she was benefiting from them. They were able to help her continue to improve, and then was starting to make the progression to where she was really improving enough to where they felt that she could participate in more physical therapy and occupational therapy and kind of try to get back to her old way of life. So at J.L. Betzel Rotary Rehabilitation Hospital, which is a part of Infirmary Health, our job is to look at each patient individually and collectively. What we do is for each individual patient, we look at their medical history, their functional status, both pre-morbid and current. We use a multidisciplinary team approach. We're using physical therapy, occupational therapy, speech therapy, nursing, pharmacy, and then also the physician to help determine what the plan needs to be for each patient individually. So, I think one of the benefits of Infirmary Health is we do have what services you need all in one place, and you were able to go to the hospital, and then from the hospital, you were able to go to our hospital-based LTAC, where you were able to continue the care, and some of the doctors that had seen you could continue to follow you, and then from there into our inpatient rehab, where again, doctors that were seeing you could continue to follow you, and you were able to kind of stay in the same system, and we didn't have as many errors because we knew, for example, you were on these medications before you came, and we were able to continue the same plan of care.
It was a great thing. I feel like everybody was going to know what's going on with me. They wouldn't have to call or get information from another place. It was just perfect that I was able to transition from one to the other to discharge. It was great. I often talk about how well I was treated and taken care of, because if you're going through something like this, the last thing you need to worry about.
One of the benefits of Infirmary Health is that we are on the cutting edge of this. We've used IV remdesivir when it first started. We have a convalescent plasma program unlike any other in the region, and if you are a patient and you are affected by this, you can feel safe to know that Infirmary Health has all the resources that you need to help you get through COVID-19 from beginning till your recovery. And I think that's really one of the great benefits of our health system.
I'm in a great state in my life. I'm living, I'm alive, I'm a survivor, I'm a fighter.